for the introduction. I'm Carolina, I'm a physio at Worthing Hospital, and I'm an elective physiotherapy lecturer at the University of Portsmouth. But today I'm presenting work that is not only mine. I wish I could take credit for it all, but I really can't. This was some patient and public involvement work about including underserved populations in our local research studies. And it was very much led by Dr. Goncalves in the room, thank you, and also Christina at the end this day. So, you must have spotted by my strange name and my accent that I am not English, but I do like to learn about the English idioms and idioms in any other sayings in any culture. And I believe what I've got here to talk about today is something I've been told is about barking at the wrong tree. And this is basically the mismatch between the people who do take part in our research studies and the people who serve at the front door when in our hospitals. So if I use the term underserved populations, which is an HR term that basically refers to populations who have a low engagement in research but a very high healthcare burden. So basically those who include in our studies often have one condition only. They have enough health literacy to be aware of research. They often have money to get transport to the study or whatever they need to do. Those are not the people we treat at the hospital, I'm afraid. So hence the barking at the wrong tree. So we set up we got a grant from the CRM to look at ways at including more of those underserved populations in our local studies. We've heard many times today that Worthing, where I work as a physio, is a lot of coastal deprivation, is also one of the older populations in the country, so you have people with multiple comorbidities. And as I say, we set up to develop those resources to find ways of including more of those populations in our local research studies. This isn't research, this is PPIE. And how did we do it? Well, we just talked to people. We just asked them. Simple as that. We had one-to-one conversations, we created a few questions, and had one-to-one conversations, face-to-face or by telephone, about why not taking part in research. Have you heard of it? Would you consider taking part? What would be the barriers or the facilitators for you? And we were interested in 3 groups of people. Those who have taken part, we wanted to know how was it for you? How did you hear about research and why did you join in? We want to know about those that have never been invited, haven't got a clue, never crossed their mind. But interestingly, we wanted to hear about those that have been invited but declined, and wanted why not? Why did they not do it? How did you find them? Sometimes we hear the expression hard to reach populations. Well, these aren't, as I say, they are not hard to reach. We treat them every day. They are flooding our hospitals, so it isn't difficult at all. We used contacts from research nurses to reach to those that had declined taking part in research studies before. Our research nurses are fantastic, and they really know their local community, and they had a list of people that they'd invited and declined. So they're really helpful. And lots of conversations with my patients at the hospital. And also we included people, we spoke with local charities to make sure we included people with sensory disability, so those who were deaf, blind, etc. And we included, have I got that on our slide? No, I don't. So we included people, you name it, people who were homeless, people who had drug addictions, alcohol addictions, who were unemployed, lived on boats, you name it. We spoke with all those people that usually wouldn't be included in the research studies that we tried to base our clinical decisions on. And what did they tell us? Well, they want to take part, and I think that was for me the most important message. They want to take part because they want to give back to the NHS. They are grateful for the care they receive and they want to give something back. Now, I am a researcher, and I can see I'll have some trouble with ethics if I start putting posters up saying, take part in my study if you want to give something back. That will be a problem. I'm sure I can't sell it that way. that won't pass ethics, I don't think. But that might be something that people do generally want to give back. So maybe that's something we can, as a conversations we can have with our patients when we tell them about research studies that are available. They wanted to be asked. They wanted to take part in studies. Ideally, if they are tag along with appointments they already have, so they don't have to come into the hospital on purpose for additional trips to the hospital. So, could you make that part of my medical appointment, please? We were talking about over lunch about going where people are. So they wanted to hear about research from places like job centres, GP practices. They will not come across the university Twitter page or wherever. We need to go where they live. When we started this, we were working on making some really jazzy videos, and we asked people, would that be alright, would that be helpful at all, have some videos on social media for you to hear about research. And they said, yeah, okay, yeah, that would be alright. But we had a big debate if they should be like animated videos or should they be like with real people videos, and there was some mixed opinions on that. They also told us that they wanted to know the researcher. If they build a relationship with those who are conducting the research, they will take part for you. Basically, they want to know who we are, and they want to, And so this is what we've done with that. There on the far right, you have that's an infographic for researchers about how to overcome those barriers to include people from those underserved populations into their local studies. Even though we were very keen on the videos, people said that videos wouldn't be enough. So we also have a paper booklet, that's the image in the middle, that we created based on what people told us. We created stories. So that's Jack's story. Jack comes to hospital. He's then been asked about taking part in a study. He really doesn't want to come back to the hospital. Thank you very much, get me out of here. But then he got to meet the researcher, and they talked about that. Maybe you could give that a go and then withdraw at any time. Okay, you could do that. So basically, those are made-up stories based on the barriers and facilitators people told us. So have that as a physical booklet. And we still made a video, be pleased to know. We went for an animated video that looks the same as the infographic and the booklet. The video is nearly there, so sorry I couldn't bring it today. Apparently there's some technical difficulties in getting it voiced and the image, I don't know. There's some technical difficulties with it, but it's nearly there. What about conclusion and next steps? Well, definitely we've heard it before today as well, that an individual approach, it's needed. So I'm telling you this worked for people that I spoke to at Worthing. Will it work in every area, in every hospital? Probably not. I suggest you go and speak with your local people, whoever they are. Also, I believe that research active clinicians or clinical academics are in an excellent position to include those underserved populations in their studies. I'm blowing my own trumpet here, because I am one. And another expression, I'm preaching to the converted, because many of you are too. But as I say, we are not just at universities, we are at the front door of care, and we speak with these people every day, and they do want to take part in research, so we are the right people to include them. And our next steps were another follow-up grant from the CRN, which we're very grateful about. And we are finding ways of further developing these resources, but also including more of those underserved groups in our research champions.